Hi, thanks for joining me today. My name's Mary Harrison. I'm a certified dementia practitioner. I also hold a certificate in gerontology and a bachelor's of science in health from Ohio University, where I studied to become a licensed nursing home administrator. I've spent the past 30 years working in long-term care communities, assisted living communities, with seniors and their families, trying to help them understand and gain the best possible care they can have. Today we're going to be talking about health literacy in seniors, using plain language to communicate effectively with geriatric clients. Thanks for joining me today. Nearly 9 out of 10 adults in America struggle to understand and use personal and public health information when it's filled with unfamiliar or complex terms. So kind of let that sink in. 90% of adults struggle to understand and use personal and public health information when it has unfamiliar or complex terms. Today, we're going to discuss health literacy and the negative impact it can have on elderly patients receiving medical services during care transitions and when making major health decisions. So when you look at that list, health literacy pretty much impacts every possible interaction that we have with our clients. When elderly patients are receiving medical services, their ability to understand and process complicated health information has a major impact on whether or not they're going to follow through with their instructions for home care. During care transitions, it's very difficult if you have a lower level of health literacy to safely make transitions between one level of care to the other. And finally, health literacy or having a low level of health literacy can definitely have an impact when someone has to make major health decisions, like whether or not to have an operation or a procedure, whether to go on hospice. So there's a lot of things that are impacted by their ability to understand complicated health information. So we just started to hit the tip of the iceberg with what is health literacy, as we were talking about the fact that 90% of Americans really don't understand the information that they need to make informed health decisions. So I'm going to invite you to take about 30 seconds and write down your definition of health literacy. And I'd like you to take it from the standpoint of what is health literacy as it relates to the person, the patient, the person who you're dealing with, and also what is health literacy as it relates to the organization that is providing the care. So two pieces. What is health literacy for the patient and what is health literacy for the organization? I'm going to give you about 30 seconds to think about that, maybe jot down a couple ideas so that as we move forward, you can develop a definition of each of these for yourself. But let's just go ahead and get started with the next 30 seconds. Okay, I'd like to invite you to wrap that up. And we're going to go ahead and take a look now at some definitions that are standard in the healthcare, health literacy realm. So you have what you were thinking, wrap that up, and we're going to discuss what are some of the official definitions. First, let's talk about organizational health literacy. What is that? What does that mean? This is kind of a new concept that's come about in the last few years as we've been discussing health literacy from a patient standpoint. It's also important to look at the organization and the role the organization's health literacy plays in making sure that people understand the health information they're receiving. So the official definition is that organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So a key component to this is that it's the equitable piece of this, that that organizations' responsibility is to make sure that everyone has equal access, that individuals can find, understand, and use health information, whether they have a computer at home or not, whether they speak English as a second language. Organizations that are providing healthcare, we need to really look at how our role in making sure that the information is accessible. A key piece of this definition that's also in the personal health literacy is its actions for themselves and others. So usually it's not just one person who is affected when someone has low health literacy. We have seniors and their caregivers who are taking care of them, mothers who are taking care of children. This health literacy goes throughout the continuum of care. In this piece, we're talking about primarily seniors and how seniors are affected by low health literacy. We have multiple generations of folks who may not understand healthcare trying to make decisions for each other, so this is not always a good thing. Personal health literacy, it's the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So the first definition we talked about was the responsibility and the role of the organization to help support individuals in getting information. The personal health literacy is just, can this person find health information, understand it, and then use it to make health-related decisions, again, for themselves and for others. This is especially true with seniors who have families who are trying to help them make major life decisions. So it's very important that as healthcare providers, we make sure that everyone in the family understands what we're talking about. When we get consent, that they understand exactly what that means. Okay, so when we're talking about personal health literacy, let's just flash back to that 90% number. 9 out of 10 people who we're working with have some level of health illiteracy. So it's not just the people who are clearly obvious that can't read or can't write. Even people who read well and are comfortable using numbers can face health literacy issues when they're not familiar with medical terms or how their bodies work. I always like to invite people to think back to the last health class you were in. Now, if you're a nurse, that's going to be a little bit different, but imagine the last health class most people have who interact with us. In my school, it was freshman year, and we had 2 9 weeks to learn all we were going to learn about our body and how it functioned. So when you apply that to people who are 50 or 60, it could have been 20 years, 30 years, 40 years ago that they really had their last formal training on their bodies and what it is they're going to do with it, how diseases affect us, what we can do to remain healthy. It's kind of scary when you think about the fact that many of our seniors who are in their 90s, their last health class could have been when they were in 8th grade, 7th grade. Maybe they didn't have any health-related real life training. We talk about how we're never going to use math another day in our life, even though we do. I think it's important for us as a society to really look at how are we educating our youth, how are we educating people about our bodies, how to stay healthy. It's becoming a matter of critical importance that we start to really do training for folks on how to stay healthy. Health literacy can be a problem when people have to interpret statistics and evaluate risks and benefits that affect their health and safety. And again, we talked about how, especially with our seniors, this isn't just the person, this is how that person is able to take care of their loved ones as well. This is important if you're diagnosed with a serious illness and you're scared and confused. If you've ever had that talk with with your own personal provider, if they've ever told you to bring a friend to your appointment, if you've ever gone in and had that diagnosis of cancer, dementia, long-term life-altering conditions, these serious illnesses, a lot of times regular, rational, normal people, when you hear the C word, all rational thought just flies out of your mind. And it's difficult to process the complicated things that we have. That's why we ask them to bring in a friend. Health literacy can be a big issue when someone has health conditions that require complicated self-care. We are expecting our patients to take over more and more of the role that used to be only for nurses. The things that we do for home care are amazing. People would still be in the hospital. We're expecting more and more of patients, but we really haven't created the support systems to enable them to do the things that they really need to do in this complicated world. Another time that health literacy issues might affect people is when they're voting on an issue affecting the community's health and relying on unfamiliar technical information. So there's health things coming at you from all angles, and sometimes it can be very, very challenging to understand everything that's going on. So as we look at organizational factors that contribute to health literacy, individual factors that contribute to health literacy, we really need to understand that environmental and individual features work together. Like in this diagram, there's a crossover between the health information, places where the healthcare is provided, the people who provide the healthcare, and with the individual in the center with their skills, knowledge, motivation, and action. So think about the health information that people might need. This is all of the written and spoken information. Is it clear? Is it easy to understand? The health information, is it easy to find? And is it provided in different forms? We can't just depend on my chart as the end-all be-all of information because many people don't access it. They don't have computer knowledge. They're from a different generation, especially when we're talking about seniors. They're much less likely to use technology and be able to go in and get that information on their own. Is that health information available in different languages, and is it culturally appropriate? Then let's look at the people who provide the health care, you and I. Are we providing person-centered care that meets the needs of the consumer, each consumer? Are we supporting the health literacy of consumers? Are we there? Are we doing the questions, asking the follow-ups to make sure that the person really understands what we're asking them to do? Are the providers skilled at communicating with consumers? And do they support shared decision making? So this is not just, I'm the doctor, I'm going to decide everything. This is, let's talk about the facts and figure out what's going to work best for you and your family. And finally, the institutions, the places where healthcare is provided. Is it accessible? How far is it from the parking lot to the front door? Is valet available? Is it on a bus line? How do people get there? And how do they get around after they get inside? It seems like hospitals are just getting bigger and bigger. And so what are we doing to support our elders and people who might have a more difficult time navigating that environment? Do the institutions have policies and systems to support health literacy? And are they consumer friendly? So this doesn't just happen magically. This needs systematic approach to make sure that health literacy needs are being met throughout the care universe, throughout hospital, doctors' offices, ancillary providers, nursing homes. How is health literacy being addressed and supported? And are there leaders who advocate for health literacy? Then in the middle of all this is the individual. What are their skills, knowledge, motivation, and action? And how is that impacted by the health information they receive, the people who provide the care, and the places where care is provided? So again, it's not just a one-trick pony kind of thing. Everything works together in order to create that entire experience of whether someone has health literacy or someone does not. So why is health literacy important? So we understand our basic definition is that health literacy for a person is their ability to access, to understand, get information about health-related conditions for themselves so that they can make informed decisions for themselves and for the people they're caring for. Health literacy is important because it affects a person's ability to navigate the healthcare system, including how to find providers and services and filling out necessary forms. Health literacy is important because it can affect a person's ability to share personal and health information with providers. And we all know that if someone's not honest with us, we can't help them. With health literacy issues, sometimes a person doesn't realize the importance of the information we're asking for. They don't really have great records, so we have to work to support them. Health literacy is important because it affects a person's ability to engage in self-care and chronic disease management. We're seeing more and more of the burden of care shifted to families and shifted to the person themselves. There's so many acute illnesses, there's so many medical crises going on that people have to be able to take more responsibility for their personal health because our hospital systems are being overwhelmed with things like COVID and trying to manage not having enough employees. There's so many things going on that people really are going to need to engage in more self-care and chronic disease management. If you have a lower health literacy level, you might not be able to effectively do that. If you have a low health literacy, people might not be able to adopt health promoting behaviors such as exercising and eating a healthy diet. They don't really follow through on things as well. And finally, it can be more difficult to act on health-related news and announcements. From a financial standpoint, for all of us, limited health literacy costs the healthcare system money, and it results in higher than necessary morbidity and mortality. That means people are sicker and they die sooner based on the fact that limited health literacy is impacting people's care. It's been estimated that improving health literacy could prevent nearly 1 million hospital visits and save over $25 billion a year. Again, as we struggle to find enough nurses and healthcare workers to fill positions, if we could even slash half of those hospital visits a year, it's going to free up more time for people who are trying to take care of chronically ill and acutely ill patients in an emergency room and in a hospital acute care setting. So I have quite a list here of things that affect health literacy, some of the factors that affect health literacy. I'd like you to take a couple of minutes as we're going through to think about in your personal practice, what are some of the things that you've seen that affect health literacy? Communication skills include all of the literacy skills: reading, writing, numbers, oral communication skills, and comprehension. Communication skills are context specific. So people who have a very limited or inaccurate knowledge about the body and the cause of disease might not understand the relationship between lifestyle factors, such as diet and exercise and health outcomes. They might not recognize when they need to seek care. So if someone has communication skills that are not fluid, that need more support and encouragement, maybe English is a second language, it can be very challenging for them to get the health care they need. They might not have the knowledge of the health topic. Health information can overwhelm people with advanced literacy skills, let alone people who have literacy skills that are not literacy skills that aren't up to par. There can be underlying stress or fear involved. The demands of the context, the situation, when you're trying to take care of your mother, you're trying to take care of your child, trying to work a full-time job, there's just so many demands of the situation, both from a health standpoint and from just a general life standpoint, that these factors affect a person's ability to comprehend and understand all of this information. Healthcare contexts involve unique conditions such as mental or physical impairment due to illness, with a stroke or with dementia, cognition issues. Many things can factor into a person having low health literacy. Health situations are often new, they're unfamiliar, they're intimidating. We put a lot of demands on people to access public health care. Many times the culture that you grew up in impacts your ability to seek and to follow medical instructions. Many cultures don't want a man or a woman, regardless of age, to be in a room with each other. So it's important to understand that there are real cultural differences, and it's definitely a situational thing. So how do people think and communicate and understand health? What do people think and feel about their health? When and where and how do they seek information? How are they going to respond to recommendations for lifestyle change? So it sounds like a lot, because it is. So many factors affect health literacy, and that in turn affects a person's ability to get that information and follow through with it. So you can see all of the things that can impact health literacy. What happens if we can improve health literacy? If we improve a person's health literacy, we can help them find the right services and doctors. We can help them manage their own chronic health conditions, help them get to the places and the appointments that they need to get to, hopefully on time. Teach them how to take their medication the right way, why it's important. If we can improve health literacy, we can help people fill out forms. Forms are very important when it comes to payment, when it comes to access to additional levels of care. So it's really important that people are able to do that. And maybe eventually they can access their online health records so they have greater control over their health. Health literacy, if it's improved, people should be able to share their medical history with their healthcare team more efficiently. Have a healthy lifestyle, and follow advice about how to look after their own health care. So the goal in improving health literacy is to pretty much improve all of these aspects and more of a patient's well-being. Okay, objective number 2. We just talked about our definitions of health literacy and why it's important, what improving health literacy would do to affect overall life and health of our patients. Objective 2, discuss who is at great at risk for experiencing low health literacy, and discuss the warning signs that we might see, the red flags in clients and patients. So who is at risk of having low levels of health literacy? The problem of limited health literacy is greater among the older adults. Think about why that might be. Limited education, that's a good one. We have older adults who, it's been so long since they learned about how to take care of themselves and their body that a lot of the things that we used to think were true have changed 3 or 4 times by now. Older adults have more difficulty just hearing the information we're telling them. There can be limited visual acuity. So health literacy is probably likely in many of the older adults that you encounter, especially when you look at 90% of the adults are having some level of lower literacy. Those who are poor have a greater likelihood of limited health literacy. So people with limited education. So many older adults are poor, and they may have only graduated in the 8th grade. Maybe they graduated from high school, but it's been a long time. Technology has advanced. People just aren't always able to keep up with all the advances at home. And persons with limited English proficiency can also be at a high risk. So I'd like you to think for a little bit, what are some of the red flags that you might see in your clients or patients that would indicate that you need to go a little bit further to assess for health literacy? Frequently missed appointments is a big one. Making appointments and not showing up early, showing up late. Many times it's because of their low health literacy. They're just falling through the cracks. Incomplete registration forms. You ask them to come 15 minutes early to fill out the paperwork. They don't get there. They say they forgot their glasses. These are some red flags that someone might have more health literacy issues, unless appointment keeping issues. This is all very important. Some of the warning signs our patient might have low health literacy. Remember, it's considered that low health literacy could be a barrier, but none of these indicators is perfect. Non-compliance with medication. They get the prescriptions, they don't get it filled, they get it filled, but they don't take it. It's important to follow up and make sure that they're actually taking the prescriptions. They might not understand how they're supposed to take them, so this is a good opportunity for change and growth. Sometimes those folks are unable to name their medications or explain why they're taking them, what's the purpose, and how much they're supposed to be taking. So let's think about some other possible red flags for low literacy. Your person might identify pills by looking at them, not looking on the bottle and reading the label. This is a real challenging thing if you have someone who is using generic drugs because of their prescription plans. They frequently tend to change the shape and the size and the color, so they just don't look quite the same, and this can be very challenging if you're not looking in the bottle to make sure you have the right pill. And if you're a senior who has lower visual acuity, this can be another challenge. Sometimes our patients can't give us a coherent sequential history. What happened when? We get long, drawn out, rambling stories, and we still don't quite understand the health things that are going on. Someone with low health literacy might ask many fewer questions because they don't really understand and they don't want to seem stupid. Lack of follow through on tests and referrals is another warning sign. So if you've made referrals to other physicians, if you've asked them to get blood work done, tests done, they might just not have been able to get to the appointment. They might not have understood the importance. But these are just some red flags, some things to look for. When these are popping up, do a further assessment to see if it's a health literacy issue. Providers for objective number 3. Providers can help reduce the risk for patients by utilizing plain language during all communication. So when we're looking at the responsibility of the organization as being a key part of the patient having higher health literacy, if as providers we use plain language during all communication, it helps us set up the stage for success for our patients. So what is plain language? Plain language is communication that your audience or your readers can understand the first time they hear it or read it. So it's plain, it's simple, it's upfront. It is easy to read, easy to understand. Easy to understand if English is your first language or your second language. Easy to understand if you have difficulty hearing. Easy to understand if it's hard for you to see. Easy to understand if you're just trying to understand complicated health information to make decisions for your loved ones. So plain language communication is written in a way so that the first time someone picks it up, they know exactly what they should do. So it's really important when we're working with plain language that as we are composing what we have to say, our written materials, We really need to focus outward on the reader and the listener and not on ourselves. Sometimes this can be a challenge. So we don't want to look at what do I want to say, but we need to understand, and the question should be, what does the audience need to know? We shouldn't say, how can I protect myself? How can I protect my interests? We should be looking at how can I serve the audience and the audience's interests. And finally, it shouldn't be what can I do to impress you? It should be what can I clearly express to my audience? What do they need to know? So again, it is all thinking about the end user, the people in their life that support them, and how we can best get the information to a level that they will understand and be able to utilize. So now we know what plain language is. We know that it's language that when you speak it, the person understands exactly what they need to understand. When you write it, they understand what they need to understand. So why should we use plain language? Plain language clearly shows that we are focused on the patient, we're focused on the client, we're trying to get them the information that they need. Plain language effectively communicates, bottom line, it simplifies and it communicates the information we need to know. Plain language eliminates barriers between what we are trying to say and how it's coming across. It can help reduce barriers for people who have English as a second language, people, again, who are seniors and can't necessarily hear as well, see as well. Maybe they have some cognitive function. Plain language is going to give us the best shot of getting the information across to the people that need it. For us, plain language helps reduce the amount of time we have to spend explaining things over and over again. It makes it clear and simple what the patient needs, and it helps us effectively get that message out. In plain language, when we use plain language, it also helps improve compliance or adherence of the person who has a lower literacy level for health. It helps make it easier for them to take their medications, to make the appointments, to do all the things that we're expecting them to do. So with the goals of plain language, they are to help the patient or the reader find the information, help the patient and the reader understand the information. And when we think back to what it means to have health literacy, it's a person's ability to find and understand information and then use it to make the right health decisions for themselves or their loved ones. So remember, if your document doesn't help the reader find the information and understand the information, then it has not been written in a plain language format. So what are the main elements of a plain language? It's very logical organization, using an active voice, using common everyday words, simplify everywhere that you can, use short sentences that have 10, 12, 14 words kind of get lost in the shuffle. Many of the people we deal with are just personally exhausted, trying to take care of loved ones, and just try and sift through all of our communication to get to what's really important. Many times doesn't happen. Use you and other pronouns to make it feel more relatable. Use lists and tables when you can. Helps coordinate your information, helps make your information easier to understand for someone who is a layperson who doesn't have the same level of education that you have. Finally, if you're writing in a plain language style, it should have easy to read design features so the person can just pick it up and easily identify based on headlines or underlines, bold sentences, so they can easily understand what it is that you're trying to share with them. When we're talking in plain language, it creates clear communication. This can help streamline the translation process. If you are trying to share your information with folks who have English as a second language, You can do so more effectively with people who are non-native English speakers and readers, and the people who are trying to translate complicated health information to people who speak in another language really appreciate the simplest possible word choices so that we can get those really important messages out. Simpler is better. That's kind of the key of plain language. How simple can we make this? How easy can we make this to understand? We are not dumbing information down by any means. We are taking very complicated information, putting it in a simpler term so that people can understand, access, and apply that knowledge to making sure that they're making informed healthcare decisions. Simpler is better. So take a look at this, and I'm going to give you about 15 seconds and try and translate that statement into something that might be a little more catchy. Simpler is better. Okay, let's see if I can say this. It's a pretty hard word. Lithoidal fragments ought not to be projected by the inhabitants of vitreous abodes. Well, that seems like it's going to be sweeping the nation, doesn't it? Lithoidal fragments ought not to be projected by the inhabitants of vitreous abodes. What does that mean? Rocks ought not be thrown by the people who live in glass houses. People who live in glass houses shouldn't throw stones. Much better that way, much better. Sometimes we use words that people don't actually understand. I was taking a tour of an assisted living community, and the person who was leading the tour of probably 10 professionals, we were there for a meeting. The tour person said, the patients who live in this section are higher acuity, and so as she rounded the corner on the turn, the gentleman who was standing next to me said, "What does acuity mean?" So he was actually an attorney, didn't understand what acuity had to do with where the people were living. So here's just a few terms that I invite you to really look at what you're saying and when you're saying them. Analgesic is a painkiller. Could you just say, we're going to give you a painkiller? If something is benign, that means it's not cancer. Can you just say, we're happy to get your test results back and it's not cancer? Cardiac problems are really heart problems. Cellulitis is a skin infection. Contraception, birth control. Enlarge means to get bigger. Heart failure, hypertension. Hypertension can be one that can be very difficult to understand. Many people think of a hyperactive child when they hear that hyper word and don't really understand hypertension is high blood pressure. Infertility, can't get pregnant. Lateral, meaning outside. So there are many terms that we're going to go over some more. But think about some of the words and some of the jargon and some of the things that you hear at your work that might fall under this category of a medical term that could be better replaced with a plain language term. So here we have some more. What are lipids? Lipids are fats in the blood. Menopause is when you stop having periods and you have the change of life. Menses is another word for period. Monitor, to keep track, to keep an eye on. Oral, by mouth. Osteoporosis, soft breakable bones. I'm going to make a referral. I'm going to send you to another doctor. Your condition is terminal. This means that you're going to die. This condition is chronic, which means it's a permanent condition. We're going to treat the symptoms, but we can't cure it. toxic meaning poisonous. So think about some of the words and terms that you use on an everyday basis that maybe you could replace with things that are going to be easier for your clients to understand. So we talked about plain language and how it helps make things easier for people to understand. This is the Coast Guard boating update information about the CO2 detector update. I'm going to invite you to take about a minute to take a look at this, to read it, and then try and reduce that 72 words into something that would make this a little more easy to understand. So we're going to go about 1 minute where you can write down what you're thinking. Okay, about 10 seconds. Okay, let's read through this. Coast Guard boating information, CO2 detector update. The Coast Guard has conducted an investigation to determine what carbon monoxide, CO, detection devices are available to recreational boaters, such that, when installed and activated, could reduce the risk of being exposed to high levels of CO, that silent killer. A variety of technologies is available for detecting the presence of CO on boats and should be considered by recreational boaters to reduce their risk of injury or death while boating. That is 72 words. I wish I could hear your responses, but I'm sure that you have changed it to where it's far less than 72 words. Let's take a look and see what an option might be. Coast Guard boating information. Carbon monoxide is a silent killer. The Coast Guard recommends that you use a carbon monoxide detection device on your boat to reduce the risk of being exposed to high levels of carbon monoxide. You may choose from a variety of devices. So that's about half the words, but it sounds 10 times better. Basically, carbon monoxide is a silent killer. You should look into carbon monoxide detection devices for your boat, period. Now here's where we get to the good stuff. Here are some communication strategies to apply when working with clients that experience low health literacy. And again, remember, 90% of the people who are in healthcare coming in to get services have a lower level of health literacy. So we have to use what strategies we can to support them. So we can improve health literacy for our patients if we practice clear communication strategies and techniques. Clear communication means presenting familiar concepts, words, numbers, and images in ways that make sense to the people who need the information. So think back to when we looked at medical terminology versus plain language words. As often as possible, if we can present information in ways that are going to be easy for the person to understand, they're far more likely to be able to participate more fully in the healthcare decision-making process, to become more independent during making health decisions, and to hopefully use preventative strategies so that they stay out of the system as long as possible. When we're talking about seniors and improving health literacy for elders, we do need to remember that some physical things are going on as well. And so make sure we understand if the person is able to hear and see and comprehend all of the data that we're giving them. So let's think about how we can use everyday words. What would we use instead of anticipate, attempt, commence, demonstrate, implement, in the event that, submit, terminate? Instead of anticipate, what should you expect to happen? Instead of attempt, please try to exercise 5 days a week. Commence, begin, start. Demonstrate, please show me. Implement, to start. In the event that, if. That is truly plain language to take 4 letters and turn the 4 words and turn into 2 letters. In the event that your head hurts, take an aspirin. If your head hurts, take an aspirin. Submit, to send, to give. And finally, terminate, to end or to cancel. So as often as possible, consider using the words on this side of our list, on the right side instead of the left side. So as we talk about the strategies that we can implement to improve communication, some of those are behaviors, things that we can do to help our clients and patients really understand what's going on a little bit better. We can use orienting statements. First, I will ask you some questions, and then I will listen to your heart. That way the person understands what's going on. It kind of sets the mood for the conversation. I would include, first I will ask you some questions and see if you have any questions and answer them, and then I will listen to your heart. Behaviors that improve communication include asking patients, have you any concerns that we haven't talked about? Ask patients to explain their understanding of their medical problems or their treatment. This is a very, very effective way to really know what persons are thinking. Just simply ask the family, ask the patient, explain what's going on to me so I can fill in the blanks for you. Again, encourage patients to ask questions. Sit rather than stand. If you walk in a room and you're standing the entire time, sometimes it can feel like you're just waiting to get out. It can be intimidating if you're standing over the person. It doesn't necessarily build that bridge to great communication. And finally, make sure that you're listening and not just talking, because there's a lot going on. So make sure that you're listening to what your patients and their families have to say. Okay, let's look at some strategies we could use for communicating effectively. It really does all start when they walk in the door to your office or to your organization. Is there someone there to greet patients warmly, receive everyone with a welcoming smile, friendly attitude throughout the visit, make sure that they're in the right spot, that they know how to get where they need to go. Next, make eye contact. Make appropriate eye contact throughout the interaction. Again, when you're dealing with different cultures, sometimes levels of eye contact are going to be different based on that person's culture. Listen carefully. Try not to interrupt patients when they're talking. Pay attention and be responsive to the issues they raise and the questions that they ask. Use plain non-medical language, and we've talked about this many times throughout the presentation. Don't use medical words if you possibly can, and if you do need to use a medical word, that's fine, but also include a definition with this so that they are able to take ownership of the material. Use common words that you would use to explain medical information to your friends or family, such as I have a pain in my stomach or my belly. You wouldn't probably say I have a pain in my abdomen. Use the patient's words back to him. Take note of what words the patient uses to describe his or her illness, and then repeat them back. It helps them have a sense that they've been heard and understood. Some more strategies. Slow down, slow down, slow down. We are all in a hurry. And that comes across as sometimes feeling that the patient feels like you're cold or impersonal. Slow down, speak clearly, and make sure that you're watching them so you can tell if they understand the things that you're saying. Limit the amount of content and repeat the content. So prioritize what needs to be discussed and limit key information to 3 to 5 points and repeat them. It's going to be very difficult for people to understand 10 or 20 different points. So limit and repeat the content. Be specific and concrete. Don't use vague or subjective terms that can be interpreted in different ways. Be very specific and let them know what they need to do to treat whatever you're talking about, how they can change their diet, how they can exercise. Be very specific. Show graphics. Draw pictures, use illustrations, or demonstrate with 3D models. All pictures and models should be simple, designed to demonstrate only the important concept without a lot of detailed anatomy. I used to go to a physician who had 6 or 7 different rooms. He had a room with stuff about the ear, room with stuff about dementia. So you would literally be assigned to a room based on the disease that you had if you had questions, so that while you were in there waiting, you could look around, see the information, and then he would use it to demonstrate what was going on. So I thought that was a great use of all of those promotional things from the different companies. So he pretty much had a little room for each thing he was going to need to talk to you about. So some more strategies for effective communication. Demonstrate how it's done, whether you're talking about doing an exercise, taking medicine. A demonstration of how to do something can be more clear than a verbal explanation. Many times when a patient is starting on insulin, the nurse will, or diabetic educator will come in and have them actually pull up the insulin and give a shot to an orange so the person can actually feel what that feels like. Invite patient to participate, encourage patients to ask questions and be involved in the conversation during the visits and to be proactive in their health care. Encourage questions. Apply the teach back method. Confirm that patients understand what they need to know by asking them to teach back the important information, such as directions. Don't just assume that they understood what you told them. This is a good place to say, before you leave, I would just like to confirm that you understood what was going on. What are you going to do when you get home as far as taking insulin? And ask them to teach back what they taught, what you've taught to them. It can be a very effective way to help improve communication. So from interviewing hundreds of patients and focus groups, there's some basic, simple information that we've learned from patients. If I need medication, break it down for me. What's it for? How do I take it? When do I take it? Or take it with food? Why am I taking it? What's the benefit of it? What happens if I don't take it? And what should I expect? Are there any potential side effects I need to watch for? So from patients, this kind of, they're asking us to break this information down for them. Some more lessons learned from patients. Tell me what's wrong. Be brief. What do I need to do and why? And emphasize the benefits for me. Just telling our patients to stop smoking doesn't let them know that, hey, if you stop smoking, maybe you're going to sleep better. If you get your blood sugar under control, you're going to be able to enjoy your day. Emphasize the benefits for the patient. And remember, finally, what's clear to you is clear to you. So just because you understand and know the information doesn't mean that our clients do. So we have a couple of lawyers over here. I think it says, we need some new jargon. The public are starting to understand what we're talking about. Just wanted to remind everyone, it's really important not to use jargon. That's an act of exclusion. Use clear communication to advance health equity. Make sure that you're not doing things like PT, OT, ST, SNF, that the person really understands what you're saying and that you're not using words that are only specific to our industry. When you're confirming patient understanding, it's best to avoid questions such as, do you understand? Do you have any questions? Usually people are going to say they do understand, they don't have any questions. It is much better to say, tell me what you understood about this medicine, or I want to make sure I've explained your medicine clearly. Can you tell me how you think you're going to take this medicine? So simpler is better. As we've talked today, health literacy is the ability of a person to obtain health information in a manner that is understandable for them so they can use it to take care of themselves and their loved ones. It really is up to us as professionals to make sure that our communication is clear and concise, that we're using plain language, that we're being mindful of the amount of information that we're dumping on someone at one time, and that we're being really clear about what's important for them to know. So, in closing, this is the non-plain lang version. I'm going to give you a few seconds to take a look at this, and then I'll wrap things up with the plain language version, and you'll understand why plain language is so important. If you have any questions or comments, I would love to hear from you. My email will be on the final slide, and I can answer questions or send you more information. I appreciate that you joined me today for this presentation and would love to see you in person again at a later date. So we said all that to say this. You can lead a horse to water, but you can't make them drink. Thank you so much again for joining me today. Please try and be mindful about the complex things that are going on in the lives of your patients. There will be a 10-question test for you to take in order to get credit for this presentation. I appreciate you joining me today, and have a wonderful, wonderful night. Thanks so much.